Good evening and welcome to Chicago Tonight. I'm Phil Ponce. On this Tuesday, May 8th, Rick Bayless's Frontera Grill on Clark Street was just named the top restaurant in America at the James Beard Awards. We'll talk with Frontera's charismatic leader. A new study finds that a one-time chiropractic adjustment can significantly lower blood pressure in people with hypertension. Carol Marine talks to the study's lead author about the remarkable findings. Queen Elizabeth's historic visit to the U.S. ends tonight. We'll talk with the author of Rules Britannia about royal etiquette, the American response to her visit, and the presidential blunder you may not have caught. It was a case that shook the city of Chicago and remained unsolved for 40 years. We'll talk to the author of the new crime memoir, 3 Boys Missing. And now to Carol Marine with an exciting new health discovery. Carol.
Phil, thank you. That exciting discovery is found in a new study reported in the Chicago Tribune today that looks at the ongoing fight against high blood pressure. For many years, anecdotal reports have linked neck pain and blood pressure. That connection now appears well-founded. According to the study, a one-time chiropractic adjustment can significantly lower blood pressure in people with hypertension. So is it time to set up an appointment with your chiropractor? To talk about this and other things, I'm joined by Dr. Marshall Dickholtz. He is a chiropractor for more than 50 years in the Chicago area, as well as, forgive me, I just lost my place here, as well as Dr. George Bacris, director of the Hypertension Center at the University of Chicago Medical Center, Dr. Bacris, and Dr. Bruce Bell, a family practitioner for the past 32 years. Welcome all of you to Chicago Tonight. Dr. Bacris, you are the principal author of the study. Will you walk us through what this is about and what you found?
Sure. Hypertension affects 65 million Americans. It's a major problem. And one day I was minding my business, running the research at the Clinical Research Center, and Dr. Bell calls me up and says, I've got some very interesting observations. I don't know if these are true, false, I don't know what to make of them. Can we get together and let's talk? And I said, well, sure, that's fine. So he brings me data from his patients and observations before and after they've seen Dr. Dickholtz. And these are people with hypertension, and they have other ailments as well. And their blood pressure is remarkably improved, and to the point where some of them weren't on medicine, but they were eminently going to be on medicine and now don't need it. Some were on medicine, they're off medicine. So we sat down and basically constructed a study that would truly assess whether in fact this was real or not. So we basically set up a pilot and statistically went through to look at changes in blood pressure and had a real procedure done versus a sham procedure, identified the patients and
the sham procedure meaning sort of the placebo procedure.
Exactly,
okay.
Exactly. And 25 people got the procedure, 25 people were randomized to the placebo procedure, and the results are what they are, and Dr. Bell actually provided us with the patients for the study. So this was really a true Three Musketeers effort.
So Dr. Bell, is this sort of like the neck bone's connected to the hip bone and it actually connects to your hypertension? I mean, is it something that anecdotally we've been talking about for years but never gave real scientific credence to?
Well, Carol, I think it's a situation that was difficult to understand because of the true chiropractic approach to some of these things were not the same as what Dr. Dickholtz did. And when I became aware of what he did, it was certainly worth my while to investigate this further and find out why the success of people that I had sent to him and why their symptoms became much better and improved and their quality of life improved.
So Dr. Dickholtz,
it was important for me to follow up.
So Dr. Dickholtz, you've been in practice 50 years.
Yes, I'm sorry to say that, but
and,
I'm happy at it.
But you shouldn't be. And so you sort of kicked off the first domino, essentially, by doing something that you began to see alleviated.
No, I had 2 mentors before me, and the technique that we use is a special, very, very accurate technique based on very, very accurate x-rays. It's called the NUCCA Technique, meaning National Upper Cervical Chiropractic Association. And there's not only a few hundred chiropractors in the whole world that are using this technique. So we want to make sure that there is a difference between different chiropractors that are doing what we call full spine work and those that are specializing at the brainstem level.
Okay, now I'm going to say, if you'll correct me where I make mistakes in this, but as I understand it, it's the C1 vertebrae, right? The atlas vertebrae?
That's correct.
Will you show us here, like, what exactly do you do that suddenly somebody's blood pressure gets better?
Basically, we're taking stress off the base of the brain. There's 300 trillion nerves that go through there. Now, the very first bone, called the atlas, is right here, and that would turn around like a ring on a finger. There is no bony interlock on that bone, but that bone is locked from one axis or another as you go through life, or born with forceps. And when that bone gets twisted, and it could be as little as maybe a fingernail, thickness of a fingernail or two, and that's enough to set, well, generally we talk about pinched nerves, but the neck is loaded with sensors. There's pressure sensors, mechanical sensors, proprioceptors, and those receptors apparently affect the nervous system and even probably the brain chemicals.
So it's like twirling the ring on a finger almost back here that suddenly...
Well, it's an accident that would twist it a little bit too far, and that little bit too far is very small, but it gets locked in the wrong position. But with very, very accurate x-rays, you can measure how it's twisted in which direction in 3 different planes.
You're a chiropractor, right? Dr. Backris and Dr. Bell, you are MDs, is that correct?
That's correct.
Is it also correct that chiropractors don't get a lot of respect from your profession, that for a lot of people they're considered sort of neck crackers, right?
Yeah, well, that is true. That is true, and I think part of the reason for that is because if you look at the procedures that have been done, this is actually one of the first times that the scientific method has actually been applied with sham procedures and truly quantitating what's been done. Dr. Dickholtz, to his credit, has very nicely quantitated the rotation, the malalignment. It's been very nicely done, and the randomization is there, so bias has been reduced as much as possible. And nevertheless, it's a pilot study. So I think the bottom line here is, if you look at this vertebra, it's unique in the sense of it is movable. And let's not forget, it's not just nerves going through there. There are arteries, there are veins going around there. And it turns out neurosurgeons have observed in surgical procedures that if they move that vertebra a bit, they unkink vessels. All of a sudden, blood flow improves the brain, and intraoperatively, blood pressure drops significantly.
Dr. Bell, we are a pharmaceutical nation. And when we go to solve a problem, I think many of us think the first thing you do is go to your doctor and you get something, a pill to lower your cholesterol, to lower your blood pressure. Is there going to be resistance from pharmaceutical companies to this procedure?
Carol, I think that at the point when we really find out through further research how this plays out and how it affects the brain and the brainstem, that there will be resistance from traditional medicine to this approach, because things will change without the help of medications. And we know how important medications are, but obviously all medications have side effects, and if we can create a solution to a problem without using medication, I think we're way ahead of the curve.
Dr. Dickholtz, what do you think is going to happen? Do you think there's going to be resistance to what seems like sort of the holistic simplicity of this approach?
Well, the point is, it's a matter of getting the public to be aware that if there's stress of the brainstem, only a very competent chiropractor can remove it. And if you remove it, the brain will control the body better.
Can any chiropractor do this?
No.
You seem to be saying no.
No.
And
They have to, it takes a lot of years of training to make sure you're taking very accurate x-rays and measure everything. We have to slip the vertebra, get the word slip, not pound or twist, slip it back, the way it slipped out, we want to slip it back in. And you have to take another x-ray and prove it.
When it comes to this kind of procedure, can you help me understand just a little bit better, Dr. Backris, what it is about this vertebrae and blood pressure exactly, and how, I mean, if this is successfully done, are you fixed? I mean, is your blood pressure good to go from now on?
Well, what I can tell you is, at least in the study, we followed people for 2 months after this was done, and everything was perfectly stable. And Dr. Bell, these are all his patients, he's followed them longer than that in a more informal way, and they haven't required the need to go back. Does that mean it's forever? No, who knows? But the bottom line is it's certainly longer than 1 week or 2 weeks or what have you. So I think it's important to understand that once you realign things, unless you have another accident or you get, then you're probably going to be stable for a long period of time. Remember now, this is a pilot study. So we need to do a larger study with specialists in chiropractic that apply the scientific method and really hone in and confirm these findings, because then we can do screening procedures, because this is not for everybody. So we need to be able to screen these people. What's the most important, what's the most relevant way to screen? What's the most cost-effective way to screen? We don't know.
Dr. Bell, for your patient, how many patients are we talking about that you delivered to this study?
50 of my patients were part of the study. I have a very large family practice. I think from 1980 until recent times, I have sent over 6,000 of my patients to Dr. Dickholtz. And that's a lot because of the needs that they have had for various medical problems.
And of that number, were many of them were hypertensive people, or they had a whole variety of
Had a variety of
needs?
symptoms, but we focused on hypertension because of the magnitude of that problem in medicine.
Right now, there are national screenings all the time with regard to hypertension. It's a very serious problem. Dr. Dickholtz, when you do this on this procedure on a patient, is there some sort of immediate sense or expression of relief from them?
Well, they'll stand straighter, and if they have a contracted hip or a contracted leg, that disappears immediately. They have more blood circulation in their face immediately, and that basically, but I would like to make sure you understand, 85% of those patients in the research practice held their first adjustment at least 2 months. One adjustment.
You just said something about a leg. Is there something about the C1 vertebra and that also relates to your leg?
The base of the brain is in the study. The base of your brain controls all the muscles of the body. If you have a stress factor at the base of your brain, you'll have spastic muscles on one side of the body more than the other. And there's been a lot of research trying to find out why people have a contracted or short leg. And that all comes right back to the brainstem.
So I have this image as a result of tonight's broadcast. People are lining up outside Frontera Grill to eat at Rick Bayless's, and they're going to be lining up at your offices to say, you know, I have this sort of high blood pressure and tension in my neck. Can you fix it?
Well, I think one has to be very careful because, again, this is a pilot study.
And you keep saying that as a cautionary kind of
That's
tale
correct.
because
it's a cautionary tale because A, I can't tell you what your risk factors are for this. I can't tell you the best screening way. We have a screening way, it worked in the study. That may be the best screening, but there may be better cost-effective ways of doing it. I can't tell you whether your norepinephrine, your serotonin, the various neurohumoral factors in the brain that affect blood pressure, what's screwed up.
But what you can tell me is this is a very big deal as a first step
Correct.
that may be a breakthrough.
That's
correct?
That's correct.
Thank you all very much for being here, Dr. Dickholtz, Dr. Bacris, Dr. Bell, and for bringing your patient with you. Thanks so much.
Thank you.
Phil, we go back to you.
Carol, I think you're right. People will have to start getting numbers for both chiropractors of that kind and also for Tara.